How do DAF and FAF help people who stutter? Imagine hearing your own voice with a tiny delay or a different pitch each time you speak. It might sound strange, but these tricks can make a big difference for people who stutter. Delayed Auditory Feedback, or DAF, plays back your voice with a slight delay, usually around 200 milliseconds. Sometimes during therapy, this delay is shortened to about 50 milliseconds. When people hear their voice delayed, they tend to slow down their speech. This slowing can cut down on stuttering episodes by up to 70% right away. Slower speech helps because it reduces the rush and tension that often cause stuttering. It makes speaking feel more controlled and less stressful. Frequency-Altered Auditory Feedback, or FAF, changes the pitch of what you hear as you speak. It can make your voice sound higher or lower. This shift in pitch also helps reduce stuttering by about 70%. When both DAF and FAF are used together, they can cut stuttering by around 80%. Combining these techniques affects both how you tone your speech and how you perceive your voice, making it easier to speak smoothly. Speech therapists often guide people through using these tools. They help adjust the delay or pitch shift gradually to find the best setting for each person. Over time, the goal is for the person to speak fluently even without the device. This process is called carryover, meaning the new speech habits stick even when not using the device. People can use DAF and FAF devices during everyday conversations to practice speaking more fluently. These tools help increase awareness of how they speak and give them more control over their voice. When using these devices, speech may sound a bit slower or more monotone, but that's part of the process to improve fluency. There are some limits, like needing headphones or earphones to use the devices, which might not always be practical. Also, while these tools can greatly reduce stuttering during use, they do not cure it permanently. They work best when combined with other speech therapy strategies that build confidence and communication skills. In simple terms, DAF and FAF help people who stutter by changing how they hear their own voice. This makes it easier to speak slowly, smoothly, and confidently. They are helpful tools in speech therapy that support better fluency and clearer communication.